Hello, everyone. How you doing? The group Let Them Play have filed a lawsuit against the state of Michigan, Michigan Department of Health and Human Services. They are saying that it is not appropriate, it's not proper that mandatory testing be done to student athletes. They say it's ridiculous. I talked to the organizer of the Let Them Play group, Jamie McIlvaney, and I talked to her about this, and she says exactly why she thinks this. And I even, asked her, well, the other point is other people are saying you don't have to play. And she has a response to that. Let's listen to the interview. Okay, so explain the lawsuit was filed officially late yesterday or this morning?
Yesterday.
Okay, what is it? What's the purpose of this?
Well, we filed an injunction to try and get things to just halt for a second while we work through this and are able to get in front of a judge. And when I'm saying halt this, we're meaning the mandatory testing that turns into mandatory quarantining, that turns into mandatory contact tracing of thousands of kids. Basically, what we went through this past winter sports was an absolute nightmare, and it did not work. And there's nobody that will argue that. I don't think there's a single person that will argue that with against me. It was a nightmare. And so many kids, people say, well, just take the test and be happy that your kid gets to play. Well, the problem is, first of all, who are you or anybody to force a parent to make that decision to have their healthy child tested 1, 2, 3 times a week for the next 3 months when they're going outside to play baseball, to run, to play tennis? Why is that group of individuals the ones that need to be tested? And secondly, it didn't help kids play. If these tests were helping kids play, then maybe you would have an argument. But the problem is it stopped kids from playing. It stopped hundreds, if not thousands of kids from playing in districts and regionals and states and just games in general. It took the opportunity away from so many healthy kids. This isn't sick kids that we're talking about. It's healthy kids with no symptoms. And we're using these tests on them 1, 2, 3 times a week and requiring them to mask and requiring them to stay 6 feet away from each other and quarantine and close contact tracing. And it's like, wow, I mean, no other part of the population is required to do anything even remotely close to this. So why are we always attacking these high school athletes?
We had a story, I don't know if you saw, we had it yesterday, the Sandusky Community Schools, I believe they're in the Thumb, they're coming out as a school district against this. And apparently they're not the only ones that have come out against this. So you are getting support from actual school officials, correct?
Correct. There's about 5 or 6 of them that have sent notes to us that they are fighting against it, or basically saying they're being forced to do it, but that they don't want to do it. They don't agree with it. And the thing is when people say, well, you're not being forced, just don't let your child play. That's wrong, because how dare you say that to somebody when they say sports is an option? No, it's not. In my house, sports is not an option. It's a must. And if you think that's weird, I'm sorry. But there's a lot of people that feel the same way as me. For my child's mental health, you can't tell me that it's optional, that I either have to sign this form or they don't play. I have to agree to have them tested 2, 3 times a week or they don't play. Like, how dare anybody put that on us parents? It's not fair.
You just answered the question before I asked it, because when you go on social media, even someone from the state, I believe we interviewed yesterday, they said just what you had argued before I even asked you that. Well, we're doing it to let them play and they're not forcing them. So you basically just answered what I wanted to ask you. And that's probably the argument you hear often, correct?
Correct. People say, just take the test and be thankful. And like I've said, if these tests were helping them actually play, then those people might have an argument, but they're not. They're stopping hundreds and thousands of kids from playing.
Have you been given, or anyone, the science and the numbers? The governor and the MDHHS, they are partially blaming young athletes for spreading, but have you seen the data, the raw numbers supporting that?
Well, I've seen what everyone else has seen, as far as that the numbers are going up and the numbers in that age range are going up. But what I tend to say to people is, okay, if you say all blue-eyed people have to be tested for the next 3 months, 2 to 3 times a week, with these highly faulty tests, with a high false positive test rate, who do you think would be being blamed? We're the only population being forced to do this. So of course, those numbers are going to go up in that age group, and those are going to be the people being blamed when you don't have to be tested to go into an airplane. You don't have to be tested to go into a bar, into a casino, into school. But then you want to walk outside of the school building onto an open field and you have to be tested.
Are you unfairly being targeted?
I feel we are. I feel that we're unfairly being targeted, unfortunately, because we have stood up for ourselves. And I feel like we know that the governing bodies don't like us very much. We're not trying to be difficult. That's not the point here at all. We don't want to be doing this. But when we see our kids, so many kids, first of all, the suicide rate is off the charts and nobody can fight that. And we just had another suicide a couple days ago. And to see these kids sitting in their rooms, sitting in their houses, doing nothing and being told, well, you don't have to, it's optional. No, we're going to keep fighting for these kids. They're the only population being treated like this.
And the question is, I've met people actually on both sides of the political aisle that have sided with you. There's obviously politics involved, but is it not politics? I've had parents that are staunch supporters of the governor and on both sides of the aisle who agree with you. I've read on your page and so forth. Is it not politics?
For us parents, it's not politics at all. And the thing is when you start coming after people's kids is when it's going to get ugly. And I think that's the situation, is our kids are continually being beaten down, and out comes the mama and papa bear in people. And that's why there's 45,000 people in that group, because we're not going to keep sitting back and letting it happen. It's not political for us. It's us taking care of our children.
It's about the well-being, and obviously being mama bear comes before anything else.
Right.
What's the next step?
It's common sense too. It's common sense at this point to me.
What's the next step, like legally? So this is now, it's filed, and what does a judge do, or what are you asking for? Like, what's the next legal? I know I could ask an attorney, but you're probably well versed since you've been involved in it. What's the next step?
Well, every time my attorney sends me something, I have to take about 5 minutes to look up about 50% of his words.
Yeah.
So I take that and I learn. But we filed for an injunction, which means we're asking them to halt everything for the moment.
Okay.
Halt it so we can figure this out with the judge. And then the next legal step would be for us getting in front of a judge. If the health department and us can't come up with something like we did the last time, we filed our suit the last time and it didn't have to go to court because we came up with an agreement that, or not necessarily between the two of us, but the next thing that happened when she opened up what we were asking for, we didn't have a case anymore.
You're right, because that's when, was it just days after you filed, and then all of a sudden it
was 9 minutes after we filed.
Oh, 9 minutes. Was there actually communication between your group and them, or was it more, you think, pressure where they just decided, oh, let's open it up?
I'm not going to speak for them, but all I know is 9 minutes after we filed our suit, we got a phone call that said we will be doing a press conference. And these words, I'm paraphrasing. We will be speaking to the public tomorrow at 1 o'clock, I think it was, regarding opening up winter sports.
So that suit was dropped because
we watched the press conference, and everything that we asked for, we were given. And so we no longer had a suit, you know?
The mandatory testing wasn't announced at that time, right? This was just recent, right?
That was just recent.
Okay.
And so it's not a part of it. It's not an executive order. That's one of the things we're questioning. It's an interim guidance. So we are questioning, where do you get the authority to force the public to do these things on an interim guidance without following the MAPA, which is in the press release, which he explained that to me because that took me a minute to understand. But we're basically questioning how they're not following the proper legal steps to continue to make these laws.
So hopefully, last question, this will hopefully prompt a discussion like last time and maybe open up their eyes, space, you're trying to say?
We're hoping for them to just see that we appreciate they're trying to, I'm going to be nice and say that we appreciate that they're trying to help the kids play, but it didn't work. And it was an absolute disaster. And these tests are being used incorrectly. Read the pamphlet that comes in the box. Don't test people unless they have symptoms. Don't test a population that does not have a high infection rate, or your false positives will go up to even 70%. and do not use these tests to diagnose people. It's clear as day. So we're doing all three of those things. It's not working.
So Mid-Michigan Now also talked to the Michigan Department of Health and Human Services, and they are saying that the testing is being done to allow them to play, to allow them to do exactly what their group says. Let them play. We have the entire interview. Let's play it.
Concerning. I will say that this is not only concerning for high school sports in the state, this is concerning for the state as a whole. What we are seeing right now is an uptick in cases across the board. So we are seeing a rise in cases, a rise in percent positivity, an increase in outbreak. We are heading in a bad direction across the state overall. And it was really driven by some of these trends in and around youth athletics. So we first started seeing a rise in cases in the 10 to 19 age group. We started seeing sports related outbreaks take the lead in terms of where outbreaks are happening in the state. And all of these young people have communities and have families. So all of these young people are then risking transmission to their parents, grandparents, other loved ones, community members, and also their schools. So we're now risking outbreaks happening in the schools.
And so what does this mean going forward? I understand starting tomorrow that you guys will have the COVID-19 testing. Talk to me a little bit about this and what are your hopes for it?
Well, I'll tell you, we've had some sort of youth athletics testing program up and running since the fall. Our fall pilot program was really successful. And this was a program where sports were at that time shut down. And so this was a way for people to finish out their postseason tournaments and games. And it was a very successful program. We had great compliance with the program. And I think it allowed a lot of kids to continue on with their athletic postseason. In the winter, what we saw was we made testing mandatory for anyone who was playing without a mask. So sports where masks are not able to be worn for safety reasons. And we also made testing available for other contact sports. And what we saw was that people really did not want to participate in the testing program when testing was available but not mandatory, which is really unfortunate because I think if more basketball teams, for example, had enrolled in the testing program from the beginning, we might not be in this situation now. So the testing program starting April 2nd is going to be mandatory for any youth athletics, so anyone between the ages of 13 and 19 participating in any sort of organized athletics is now going to be required to test. But what's really disappointing is we're hearing about a lot of groups who don't want to do this, who are resistant to testing, and who feel that this is somehow going to hurt their child's chances of playing athletics. And I just really want to let everyone know this program is only going to work if people are committed to making it work. If people are actually cooperating with testing, cooperating with case investigations, with contact tracing. The whole goal of a testing program is to keep athletics going and to allow students to be able to participate in things in a more sort of normal way to get people back to the sense of normalcy. So the testing program is there to help. It's not there to hurt. It's there to detect cases early before transmission occurs, before outbreaks occur, to prevent some of these whole team quarantines. And so again, if people test in a voluntary way, if they cooperate, I think that we could move things back into a much more positive space here.
And if people don't, what are those consequences?
Well, we'll just keep seeing outbreaks. We'll keep seeing cases going up. We'll keep seeing outbreaks. We'll see unmitigated spread. And one of the things that's really concerning right now is we have variants here in Michigan. We know that we have variants circulating in Michigan. The more the virus gets a chance to spread and be transmitted without anything impeding that, the more we're giving the virus a chance to mutate and for more variants to develop. So we're really putting ourselves in a bad position by allowing spread to occur like this. My hope is that people see the testing program as a way to allow athletics to continue the way they did in the fall, the way that that we had intended for things to happen in the winter. So think of it as an opportunity to allow things to continue, but in a safer way. And I think that we have a great partnership with MHSAA. We're developing our partnerships with private clubs and leagues, and we really want to support people and give them whatever tools they need to participate safely.
And you emphasized it already, but for those people who are hesitant about testing, who feels that it's a violation of their rights, they don't want to do it, what message would you say again, so we could continue moving forward and we don't have to see the cancellation? Would you just emphasize that again?
I would say that you should see testing as an opportunity. This is just one more tool to keep our kids safe, to keep our community safe, to keep schools safe, to keep things open and functioning in a more normal way. And the only way that this will work is if people are invested and committed to making it work. Safe testing is exceptionally safe. It's very easy. We're trying to make it as easy as possible. We've just changed the reporting requirements, so reporting is now easier. We want to really reduce any barriers we can to make testing more accessible, because this is one of our most effective tools in combating the rise in cases and preventing another massive surge.
And you can go to our website, midmichigannow.com, just search Let Them Play, and you can read much more about this and other stories we have done.